Aaron Rodgers, Aaron Judge, 2 injuries, but one guest to help us break it all down. Dr. Stacey Paukovitz joins the show. Diamond Diehards is on. Joe Rizzo here bringing you medicine, modern medicine. It's Dr. Stacey Paukovitz, high performance foot and ankle in Manasquan, New Jersey. A longtime friend of mine, a trusted friend of mine. And after the whole Rodgers thing happened, I basically begged her to come on and do this podcast. So, Dr. Stacey, welcome to Diamond Diehards. We are glad to have you with us to break down in better than layman's terms, in professional terms, exactly what happened to these guys. We're adding Aaron Judge in there because it's like a relevant thing as we head toward the end of the baseball season and the off season. So thank you for joining us. You're now another one of the Fordham crew that has made it onto Diamond Diehards, and there have been a bunch, but maybe you're the most prestigious, the only doctor.
I can die a happy woman. I finally made it.
So we have this Rodgers injury, right? And people have been watching sports for a long time, especially football, who have seen that Achilles injury. Or if you know the way athletes react when they have like a really serious catastrophic injury that's not like from like a big hit or some big contact, like a pitcher getting hit with a ball or something like that. This was one of those. Like you saw Rodgers, he goes down, he gets up, and he's about to go into the huddle to call the play, and then he takes 3 steps away and he just sits down in the middle of the field. And for those of us who have been watching it for a long time with no medical degree, let alone a specialty like yours, you just knew that it was bad. But when you saw it, did you know exactly what it was?
Not from the video. And I've watched that several times with him getting hit. It was very hard to tell, especially because Achilles ruptures are usually a non-contact injury from just you pushing off very hard. So he must have just had a direct trauma, or his foot just twisted funny, but I've looked at it from every angle. So no, I thought maybe he just had an ankle sprain at first, not the Achilles.
Okay. ESPN later, it wasn't on the broadcast, but later on, I think it was on SportsCenter, they did an ISO shot and they blew it right up to where the calf was. And you could see it turn and you could see it go snap. And then you could see the calf muscle just, look like it got twice the size for a moment. And you could actually see it like, poof. It's kind of interesting.
They were comparing that to the way when they zoomed in on Kevin Durant as well. So yeah, when you zoomed in close, then you could really tell. But just from the shots from the game, it was hard to see.
So he had the surgery. He goes to someone in your profession named Dr. Neil Elatrash, who's done a lot of these and basically has at least been credited for making some advancements in the process. Just at the beginning, for a typical person, as I said to you in preparation, what's the difference between doing a surgery on Aaron Rodgers, 39-year-old NFL quarterback, versus, John Smith, 55-year-old pickleball player? Like, is there a difference in the surgical approach when you're doing this?
Well, when you're a high-level athlete like Aaron Rodgers, first of all, you're going to fix that Achilles tendon. You're not going to even consider a non-surgical option. There's many factors to take into consideration, surgical versus non-surgical, but when you're a professional athlete, they're going to get them fixed, as opposed to an older gentleman playing pickleball. If he was in poor health, you might not, have surgery on that type of injury.
So there is a way to go about it without even having surgery, but that's really not any kind of option for a professional athlete, or at least one who wants to return. Why would one, because I'm sure there's probably people watching this who have gone through this or maybe haven't, but will. Why would you choose to not do surgery when the surgical procedures seem to have a pretty high success rate?
I think things to take into consideration is a patient's overall health, their age, and their activity level. But if you're going to even consider a non-surgical option, the diagnosis has to be made within like 3 days or so. So even surgery, you want to do that as quickly as possible as well. But any professional athlete, the majority of the time, unless there's unforeseen circumstances, is going to have that surgically repaired.
Okay. Typically, how long? So, okay, now that's sort of other part of the question. Are you doing the surgery differently? Say 55-year-old pickleball player decides to have the surgery. Are you doing it differently on him than you would for an Aaron Rodgers who's 39 but wants to come back and play at an NFL level for a quarterback?
I don't think you're approaching the surgery any differently. It's just pretty much based on the actual injury. Is it a clean rupture? Are the ends close together? Do you need a tendon transfer? So it's not like you're going to do less of a surgery for that 50-year-old gentleman as opposed to Aaron Rodgers. I'm sure there's a lot more pressure and stress on an Aaron Rodgers case. But as far as addressing it surgically, there's not going to be a difference in a surgeon's approach.
Okay. So I was reading an article that talks about the internal bracing procedure and adding a sutured bridge brace over the top of the repair site. Have you run into this at all?
There are so many different procedures for the Achilles tendon. An open procedure, you can do a minimally invasive procedure. The internal brace is equipment made by Arthrex. And every company has their thing to help with the repairs. So that's going to be based on just what the surgeon's used to and the surgeon's preference, not that one is better than the other. It's pretty much what the surgeon's been used to using.
Over the past, say, 20, I mean, you've been practicing 20 years or so, right? It doesn't look it, of course, because you look like you just got into the business.
Yeah, right. Thanks,
yeah,
Joe.
you're welcome. take off your glasses and it'll look like I just got into the business too.
You're on now, yeah.
So let's just say the past 20 years, how has this procedure evolved? And for athletes, this was typically either a career ender or a real career altering injury. But in the past few years, we've seen some, like you mentioned, Kevin Durant. Kevin Durant came back and he looks like Kevin Durant, and he did it when he was like 32 or 33. And he's come back to look like Kevin Durant, and he's moving laterally, he's moving up and down. I mean, he's constantly in motion in his sport of basketball. And he was out for really about a year's time, but I think he was sort of ready to go and kept conservatively. He was probably ready to go in even a little bit less than a year's time. And then we had this guy from the Rams in 2021, Cam Akers, a 22-year-old running back. And, I guess his rupture was clean and he was solid, or however you say it, on either side. So he had a lot to work with there, and he returned to the NFL field in 5.5 months. So like those stories weren't even happening 20 years ago. It was either like, okay, your career's done, or we'll do what we can and like maybe get you back on the field if you're lucky, but you'll be a shell of yourself. Is this because of the procedure? Like, what has happened in this last 20 years to make this possible?
I think we just have more of an awareness of what we can do in the earlier recoveries. And we also have, new products, new things on the market, the ability to isolate growth factors and stem cells. That all helps in the healing process, as well as the new equipment that's out. And they do studies on that as far as strength of the repair. So yeah, medicine's come a long way as far as quicker recoveries. Getting back to the comparison with the 55-year-old pickleball player and then Aaron Rodgers, I mean, there is no comparison as far as their activity level and what their bodies require of them. So that pickleball player might be able to recover in 6 months, but they're going to wait and rehab Aaron Rodgers to take that full year. I mean, I think that's really what the issue is with the Achilles tendon, the process of getting back to what's required of you, that high level um, with his professional sport. He's going to take that full year or even longer, but he has time to dedicate to his rehab process as well.
So is it really how much you can put into the rehab and how soon you can start rehabbing it that makes the difference?
Yeah, I think that makes a big difference. Aaron Rodgers is going to be strictly focused on his recovery, his diet, getting sleep, his rehab. I mean, he's going to be able to do that full time as opposed to somebody that, as a family has to take care of the kids, go to work, and then rehab at night. I mean, his entire life now is going to be dedicated to his rehab process. So, the odds are in his favor. Obviously, a professional athlete's mentally strong. And, from what I've read and his interviews, he's ready to come back.
It really is amazing when you can even like have these conversations to the point where you could say as an informed professional that the odds are in his favor of coming back well and sort of being himself at this point. It like really, even I would say even 5-6 years ago, you would never really be able to make that statement. And yeah, you made it pretty confidently. I mean, it doesn't mean it's guaranteed, right? But like you said, he's fanatical already about his diet. He doesn't eat sugar. I can't even say that. Like I probably had sugar within the last 10 minutes and I'm pretty good, but still it's like you can't avoid it. What's the hardest part of the rehab? Is it like when you, so as a surgeon, you're not seeing your post-op patients on a daily basis, but you're checking in with them how often?
I see my post-op patients quite often, and I'm in direct contact with the physical therapist that I send them to. So I do have constant contact regarding their rehab, not just doing the surgery and then seeing them 3 months later. But I do that for any type of surgery that I'm doing on my patients, which I think even the communication that I have with my patients and seeing them often actually helps with their recovery. So maybe I'm a little bit different as how often I see my patients post-operatively, but I think that's, part of the success of the surgeries that we do.
And then as far as physical therapy, like, are they able to rehab, like Aaron Rodgers is in a position where he could rehab it 7 days a week, right? If he would have the resources to be able to do that. Whereas, the average person certainly would not. Is that recommended if you could do it? Like, is it definitely just go for it? The more you could do, the better you're going to be? Or is it like, you got to tap the brakes a little bit here and there?
Right. I mean, there's certain things that you can, help as far as his training facilities and that kind of thing. But also, you just have to be okay with the entire healing process. Like, it's going to take a year for this Achilles tendon to rehab to get to the level that is required of him to play a professional sport. There's no way to speed that up. And if you try to speed that up, he runs the risk of re-injury. So that's where there's kind of an issue too. Yeah, everyone wants to see it as a big thing. Aaron Rodgers playing this season with a new team, huge disappointment for everybody. But you have to go about this the right way for him to make a full recovery. The Achilles tendon, it's the largest, strongest tendon in our body. You need it to run, you need it to jump, you need it to push off. And coming back too soon could actually be very detrimental. So yeah, technology is better. He has the ability to train, all day long if he wanted to, which isn't recommended. But it's also a tincture of time. You just have to go through the proper channels so he can come back, close to 100%.
So I remember when it happened with Kevin Durant a few years ago, one of the things that was kind of constantly brought up was that when it happens to a player or maybe even a person on one side, that the chances of it happening also on the other side are greater, that you're just more prone to it. I don't know if I'm remembering that correctly, but in your experience, is that something that's like valid?
I think that's valid with any injury. I remember, in college when I tore my ACL, my daughter tore her ACL, and, not only are they rehabbing your bad leg, but they're constantly rehabbing your good leg because you don't want to favor the one side, make that stronger, and then you're compensating, which would lead you to an injury on the other side. It doesn't make you prone to an injury on the other side, but I think you just have to concentrate on rehabbing both sides so you're equally as strong.
That is very interesting. I think it's sort of an underrated part of what we think of when we think of the rehab. Like in our mind's eye, you think of Aaron Rodgers going in and just, doing the foot exercises on one, but anything he's doing on one side, they want him to continue doing on the other. Is that typically the way it goes?
Yeah, they're going to focus on his bad side first, obviously, because that has a lot of catching up to do. But yeah, any athlete has to be aware of that. Yeah, for sure. But it doesn't make you more prone to doing it on the other side.
Okay. Let's give a couple little shout outs here to people and companies that support us. Gatto Acupuncture and Wellness, now in Franklin Lakes, New Jersey. Book online at gattoacu.com or call 551-212-3845. Dr. Melissa, she will take care of you. She helped me. There was a point where I couldn't lift this thing above me, and then acupuncture one day and boom, I was as good as new. If you are looking to relocate anywhere in the Northern Valley, the Pascack Valley, or anywhere in Northern New Jersey, Mascolo Group Realtors can suit your needs. If you're looking to get in, get out, buy, rent, whatever you need to do, go to GaryMascolo.com or call 201-615-3665. FMSgraphics.com, a family-run, family-owned business for over 50 years. Go to FMSgraphics.com for all of your printing and promotional needs. That includes you, Dr. Stacey. If you want to get stuff out there, you want to print up little, something or others and hand to people, maybe like a little ankle with like something on it that has your logo on it. You hand it out to people. Just an ankle, just the ankle bone like that. You could do that. FMSgraphics.com could do it for you. And let's say you went down to High Performance Foot and Ankle in Manasquan, New Jersey, hpfoot.com for more information. But let's say you went down there and you had to see Dr. Stacey to get your stuff fixed. And because of all the sand and everything by the shore, your vehicle got dirty as you were heading back up to the Bergen or Passaic County area. Big Ed's Car Wash in Fairlawn. You got to stop in there. See Big Ed, 17-16 River Road in Fairlawn, clean and green. Ed has a 118-foot tunnel. You don't want to miss it. Tell him Diamond Diehards sent you. Seriously do that because Ed will just freak out. They'll love it. He's a great guy. All right, there we go. So we did our little spiel over there. Before we talk about Aaron Judge, let's talk a little bit about you, Dr. Stacey. So our relationship is that you played basketball at Fordham, and I had the privilege of calling many of your games and your former teammates' games, and affectionately, especially for the Lady Rams. I was known for a time as the voice of the Lady Rams, something that I was very, very proud of. I drew very good favor with a lot of parents and grandparents from the girls' team and the men's team as well. So that was very rewarding. And I took a little hiatus in that part of my career until about 2007. I was writing for a while. I zigged and zagged and did a couple of other things, and then decided to start to do podcasting a little bit on the side. And I've been doing that for about the last 15 or so years. And in the interim, you decided to rehab your knee injuries, play a little more basketball, and then go to medical school, and here you are. So tell us a little bit, color in some of those lines that I just drew for us, so people get to know you a little bit better.
So it was actually 2 weeks after I signed with Fordham. I was in an AAU tournament, and typical foot planted and twisted and popped my ACL. It's so funny how back long time ago, you just didn't hear about ACLs that often. Now it's happening all the time. My daughter included. She's a basketball player at Dartmouth University, Dartmouth College, and had a red shirt last year. So she's ready to play this year. But it's a devastating injury, very similar and compared quite often to an Achilles rupture. Although they even say Achilles ruptures can be even worse. So went into Fordham redshirted, spent a lot of time in the training room, very humbling experience, learned a lot about myself. I guess I'm grateful because it got me interested in medicine. And, I came back the next year, played the remaining 4 years. So I was at Fordham for 5 years and had a great career. It was tough mentally, as any athletic injury is. Again, you learn a lot about yourself, but you definitely can come back stronger, more determined. And then I found something that I love to do that I spent the rest of my life doing, helping others at High Performance Foot and Ankle. I am a very lucky person. We see a lot of local athletes. Pictures are up all around our office. A lot of women basketball players, any sport we see. But it's a real joy. It's a real joy to help these young athletes get back into action. You talking about new modalities that are out there, laser therapy, PRP we do here. So there are little tricks, up our sleeve to help an athlete recover quicker. But I guess me rehabbing my injury, led me to my profession. So I guess it was all good. Here I am now.
And it remains all good, right? Because you're just getting started pretty much. Because with one kid in college and another on the way, you don't have a choice.
A very long time. Yes.
Yeah. Keep it up. Make sure, if you just feel like your ankle just doesn't feel like 100% today, even if it's 98%, go stop in.
No, I truly love what I do, and I'm truly blessed, for what this practice turned into. I worked for a couple practices. About 8 years ago, I opened up on my own, and it's been fantastic. Being in this small town of Manasquan and all the, local, surrounding towns, it's been really, really a pleasure to get to work with these athletes, and not just young athletes. We obviously see all ages. Pickleball's kept us busy with some injuries. Any sport, a lot of ankle sprains, a lot of Achilles, just like we're talking about today. But yeah, I love what I do, and I'm very blessed.
And I have to say, the officers are nice. Our own producer Xavier Rizzo has been at times a patient of yours as well. Maybe
Yes.
maybe your favorite of all time.
Hands down. Yep, you made the trip down, which I appreciated.
Yeah.
Love seeing.
So, okay, that leads you to here where you are, and then now we could talk about what everybody else has been waiting for, which is Aaron Judge. So, in what was it, early in the season? I don't know, was it May or June? He's at Dodger Stadium playing right field, and he makes just an absolutely unbelievable catch. I mean, not even just a catch of the year candidate, but a catch of like the decade level. He smashes through a fence that's not a gate. It's a fence. And the bottom where the wall was the concrete slab, unprotected. Nobody's ever thinking that they're going to slam into that thing, right? And of course, now they've eventually made the change. And he makes the catch, and the next thing you know, he's got a toe injury that leaves him out for a couple of months, and then he comes back, and he's at times looked normal, and at times not so much. And I kind of felt like if the Yankees really they've kind of fallen out of it. I felt like maybe they would just shelve him, but he was just saying as recently as I guess this week, the second week of September, that he has no intention of shutting it down, and he's going to play through. If you're advising on something like that, and again, we're talking about a major leaguer here, and an outfielder who's a very good defensive outfielder, and belongs playing in the outfield and not just as a designated hitter, like is he really risking anything by playing kind of meaningless games in September? Like, is there any benefit to him shutting it down? Like, see if you can give me the whole 30,000-foot view here.
So it's actually he has a turf toe injury basically. So what happened when he caught that ball and hit the hard fence, his big toe hyperextended, injuring, his plantar plate or collateral ligaments. It was unclear in the beginning. They were saying you weren't quite sure what Aaron Judge did to his big toe, and then later it came out it was an actual turf toe injury. And again, if it's a grade 1, grade 2, you're usually immobilizing, resting, rest, ice, compression, and getting off that thing. Not that you have to go to surgery right away. Probably got x-rays, he got an MRI. And it can vary when an athlete comes back. They can be back in 4 weeks. I think for him, he was out, 2 months?
Yeah, it was 2 months or over 2 months.
I mean, an athlete of that caliber, I think, if he was feeling better, I know for a fact he had received 2 PRP injections from his doctors, and I think he was feeling pretty good and trying it out. Is there a risk for him re-injuring? There's always a risk for that. Might he end up getting surgery in the off season? That's always a possibility. But the typical treatment plan is just treating it conservatively. And then if he finds that he just can't perform at the level he needs to, he might end up getting surgery in the off season. Although I know he denied, wanting to do that. But if Aaron Judge can't compete the way Aaron Judge competes, he's going to end up getting the surgery. You need your big toe to push off. You need your big toe to jump, just like the Achilles tendon. So for a professional athlete, a turf toe injury is actually really serious.
What kind of surgery would it be if he elected to do that?
Repair. So your big toe joint, coming through it is a capsule, which includes your ligaments. There's something on the bottom called your plantar plate, which actually stabilizes the big toe. So when he hyperextended, he injured they were talking more about his collateral ligaments, the ligaments on the side. But a turf toe injury can also include that plantar plate. So they would go in and primarily repair that.
And is that something, in terms of rehab, you said it's treated conservatively. Is it more just rest on that? Or is there any kind of rehab that you could do?
It's pretty much keeping it still. So a lot of times athletes will get casted with the toe in the opposite direction, a plantar flex position, staying non-weight bearing, cam walkers, which are those rocker bottom boots to take the pressure off, just to immobilize the toe so you're not moving it. That's something you don't want to go to physical therapy for and then create motion. You want to let that area rest so you have the best chance of healing that plantar plate and collateral ligaments. I describe that like almost like a cocoon around the joint, and some of that on the bottom got disrupted. But yeah, that's not something like you immediately want to start physical therapy for range of motion. You want to let that area rest to potentially heal. And that's why they did the PRP injections, because growth factor injections can help the healing process.
So that's PRP is platelet rich plasma. So that's great, but like, do you also have to do more things involving circulation? Because isn't circulation typically made better with movement?
Right, but you have to also, if you're moving that too much, you're disrupting the plantar plate. You need to give that area time to heal, and then you do the rehab process.
So one comes before the other. So if he had to wait for that to be somewhat stabilized before the PRP injections would even do anything.
Correct.
Oh,
Same
okay.
with the Achilles tendon. You're not going to physical therapy right away and going crazy. You have to rest it, allow it to heal, gentle range of motion, and then you progress.
Yeah, I'm doing good. I think that if you need like another doctor in the practice, I mean, I wouldn't choose me, but like, listen, maybe I could bullshit my way through a couple of patients.
Hi, Joe. I wouldn't put it past you.
Yeah, we could just give me a coat, a white coat. I hate the white coats though. They give me the creeps.
And then I'll go do what you're doing. That would be nice.
Oh yeah, you could do it. It's no problem. For somebody like you, it's easy. It's easy. Okay. I got a little I got a prop. I got to reach down to get it though. Let's see if I could do this deftly. I have a standing desk. So I'm never sitting when I work. I'm like working all day at my desk and I'm standing the whole time. And I have this. It's pretty beat up. But can you see what that is?
Mm-hmm.
It's like half of a foam roller, right? So it sits like this. And guess what I do with my feet? I put it on there and I'm stretching my Achilles every day. So is that good? Am I wasting my time? Is that bad? Should I keep doing it? Is it?
No, it's good. As we get older, our collagen's changing, and of course we tighten up. A lot of foot issues I see are directly related to a tight Achilles tendon. That's why they call it the weekend warrior. Achilles ruptures don't discriminate. You could have a very high intensity athlete, professional athlete, such as Aaron Rodgers, or you could be out next weekend playing pickleball. So, no, it's always good to stretch your Achilles tendon for sure.
I was trying to impress you. Like that's a real thing though. I didn't just make that up. Like I literally have had that thing and I got it from when I was at physical therapy, not for really my Achilles, but more for like hip and back stuff. And they're like, oh, just make sure you keep stretching your Achilles. Like do all, like they gave me all kinds of different stretches. I'm rocking back and forth, and I'm always stretching that thing. And I feel like it makes a difference. I don't know.
Yeah, it definitely makes a difference. Stretching your Achilles tendon is the number one treatment for plantar heel pain or plantar fasciitis as well. So there's great benefit to stretching your Achilles tendon. And even, going out and playing a game of tennis or basketball, you have to make sure you're warming up before and after. There's less of a chance of injuring yourself with stretching. So yeah, good job, Joe.
What else do we need to know about like general sports injuries that are from, the ankle down? Like I think we probably covered the big ones there with the Achilles ruptures and the turf toe. I mean, those really are, right? Like when you talk about from, foot and ankle, those are, and I guess the other one really that you hear about a lot is plantar fasciitis. You sort of like dove into that a little bit, but not too much. Maybe is that worth a few minutes?
Well, plantar fasciitis is probably the most common thing any podiatry practice sees. It's a diagnosis of older people. I would say 40 years and above is the prime age to get plantar fasciitis. Once again, because our collagen's changing and we're tightening up. I really don't see patients in their 20s and 30s with plantar fasciitis. So you definitely need so many miles on your wheels for plantar fasciitis to occur, and it's from constant repetition, change in surfaces. You standing all day could be a predisposing factor. Lack of stretching, walking barefoot can aggravate it. Younger kids get heel pain, but that's more from a growth plate inflammation called Sever's disease. So we'll see heel pain in young athletes from the ages of 8 to 12 or 8 to 14, and then I won't see it for a while. And then come age 40, you're seeing plantar fasciitis kick in.
Okay. How come I have like twisted my ankles to the high heavens? So one day I'm going to tell a story because everybody who watches or listens knows how much I love to tell stories. So you're going to have to sit through this one. You might have heard this one already, but we'll just tell it and then you can respond to it. So one day I'm like 2 blocks from my office when I was working in New York City, and I'm standing on Fifth Avenue looking straight ahead at Grand Central Station on 43rd Street. Okay. So there's a visual for the New York people. And they had just paved the road. And there's a storm drain right in front of me. And I'm not on my phone, but I'm not really like paying attention to the step right in front of me because I walk over it like every day, twice a day. And what I didn't realize was they set the storm drain like down. So it wasn't like a sewer grate. It was now just like the square one, and it was set down, and there was a big angle around it on all 4 sides. So when I stepped off the curb, I expected it to be like the normal distance between your foot off the curb and onto the street. But what it was it was like 1.5 times more and slanted sideways, and I wasn't looking. And I stepped down, and well, actually, so it was my right foot, and the slant was to the right. So I stepped down, and my foot lands, and I hear, and I'm like, oh my God. I was afraid to take the next step. I'm like, oh my God, my ankle just popped. Like not when you crack your knuckle. That, I don't know if you heard that. Not like that. It was like, whew. And I was so scared to take the next step, because now I'm taking a step into like Fifth Avenue in New York City, right? So, but I'm like, all right, I can't just kind of stand here. And all of this is like transpiring in my head, but it's all taking about a second, right? So I take the next step with my left foot. I'm like, okay, now here's the go. And I take my step with the right foot, and I'm like, okay, that kind of seems okay. And I'm like gingerly walking across the street. I'm like, all right, I think I'm going to make it across the street. I'm just looking around if there's a person next to me in case like my foot just goes down. And I just keep walking. And I'm like, and now I'm like into Grand Central Station. And I'm walking through Grand Central Station. I'm like, my ankle is not even sprained. What is going on? So I do have this thing where I could like walk on the sides of my feet. Like if I take my feet, I could walk on the sides of my feet like that. So am I just some kind of weird genetic freak? And generic too. Generic, geriatric, any of the G's. It's unusual. I have to say, like, I've definitely twisted my ankle a lot of times, and I feel like I just keep getting away scot-free, like all the time.
Well, you have more, usually when you have a lot of inversion capabilities where your ankles are weak, if you hit any uneven ground, your ankle's going to roll. So it kind of is surprising that you had that kind of force on that angle and you didn't sprain your ankle. But you must be superhuman.
The ankles are, I think, I don't know.
They might be.
I got this, I definitely have this thing where every time I'm like fat, and people ask, like, people miss my weight by like 20 pounds, like under. They're like, you weigh that much? I'm like, yeah. I'm like, so I think us Rizzos have, like, we have really thick skeletons. So I think, and you know, my dad, when he was getting a hip replacement many years ago, he was like, how old was he? He was like in his late 70s, and they broke the drill bit because they couldn't get through. They had to use they're like, you got the bones of like a 30-year-old guy. Like, we couldn't get through there. So I'm hoping I got a little bit of that. Maybe I do. But
Probably.
now you know. You could check out my ankles the next time you know, it's beers at the Rizzo's or beers at Dr. Stacey's. You'll have to just have a look at the Fred Flintstone feet and the big thick gorilla ankles.
We'll have to do that, definitely.
Yeah.
Sometimes when you have that type of a lot of hypermobility, you can get your ankles stabilized. We see a lot of that after the fact. Say a college player, you know, would get taped or wear ankle bracing, and then they graduate from college, and you know, they want to start running, and they're scared to come off a curb because they just have no protection on the side. They sprain their ankle so many times. And sometimes you can be born with lateral ankle instability, but there are pretty simple and very successful stabilization procedures that are out there. Most of the time when we see ankle sprains, and we see a lot of them at my office, probably like 4 new ones today, you know, we're rehabbing those. You're not going in right away and primarily repairing them. And they come back. It's a successful recovery. But with multiple ankle sprains, you're running the risk down the road of just having chronic lateral ankle instability. And as you get older, that just doesn't seem to work out. You know, you're scared to even come on any uneven grounds, because you'll just roll your ankle because you have no lateral ankle ligaments anymore, pretty much.
I'm gonna say yoga or hot yoga probably helped me.
Strengthening up, you mean?
Well, I mean, I don't know. It didn't sprain when it twisted like the bejeepers. So maybe
I
I
mean,
was.
definitely ankle sprains are a definite after when you're recovering, it definitely is a physical therapy rehab for that. That's a must for my athletes. And, I'm not sending everything to physical therapy, but ankle sprains on a young athlete are a must.
I would say all the push-ups that I did just on my big toes. I don't know if I could still do that because I haven't done yoga for a long time, but I could do push-ups just on my big toes.
You're going to end up with a turf toe injury, Joe.
No, I think I'm preventing it. I'm going to say, because it really made a huge difference. Like I felt like doing that absolutely just strengthened my feet. Like I noticed when I first started doing it, I noticed within a week that my feet were like immensely stronger. So yeah, I think push-ups on only your big toes with the benefit of a yoga mat, I'm going to say those are good. I'm going to say those are good. You could disagree because you're a professional, but I'm going to say it made a big difference in my life doing that. And now I'm going to vow to start doing them again tomorrow. I'm going to start doing them. So we'll see. And then I'll report back to you if I could still do them, but
We'll do a case study on you, Joe.
yeah. Oh yeah. I love to be studied.
Yeah, that's a good idea.
Yeah. I didn't like to study very much. But I do love to be studied. That's a better way to go for me. Okay. I think we can wrap it up there. You covered so much and so in depth. I can't wait for the next big injury just so we could have you on, or if you want to just talk about whatever, then we could do that too. High performance foot and ankle in Manasquan, New Jersey, www.hpfoot.com. It's Dr. Stacey Paukovitz, the great, my wonderful, talented, longtime friend. Thank you so much for your insight and your talents on this episode.
And a big shout out to Dartmouth women's basketball. Looking forward to this season. They have a new coaching staff. Players are super excited about this coming year. So hoping for a good season in the Ivy League.
Oh, well, I mean, if we're doing shout outs, then we're going to shout out the New Jersey Bandits U19 AA girls hockey team.
That's right.
Which you could go check out their play-by-play and the live stream of all their games. This guy, it's on my other channel.
But we need Louisa to get up to Dartmouth for their hockey team.
From your lips to God's ears.
Yeah, definitely.
Pick her up on the way to the next visit.
Yeah, no doubt. We have to set that up.
Okay. All right. We gave you all the stuff. If you want more information, you can look for it, as we do always. Put it in the description of the show, no matter where you are checking it out. If you're watching it on YouTube or Facebook, or if you're just listening to it on Spotify or Apple Podcasts or Amazon, just go to the description. There's descriptions no matter where you find the podcast, there's always a description, and you can find more information about Dr. Stacey's practice or any of our other sponsors. If you want to check out the show, hit the subscribe button and the alerts button wherever you are listening or watching, and come back and join us for future episodes. Yeah, we mostly talk about baseball, but we're branching out and doing a lot of other different things. And, sometimes it's with the co-host, the dog, Jeff Healy, or the rookie from Monmouth, Aaron Mulligan. Sometimes it's just guests like this with Dr. Stacey, and we push it, outside the realm just of baseball and talk about more great other things. At Diamond Diehards on Twitter and all other social media if you want to follow. That is going to do it for Dr. Stacey Paukovitz. This is Joe Rizzo. Diamond Diehards is out.